Talking about Lassa fever, the World Health Organization fact sheet on Lassa fever says Lassa fever is an acute viral illness that is caused by Lassa virus. The African CDC says that Lassa fever is an acute viral hemorrhagic illness that is endemic in some countries in West Africa. It's an acute illness. It's an acute illness, you know, and it's caused by virus, Lassa virus. It's an hemorrhagic illness, meaning that it can cause bleeding to occur in different parts of the body. We must remember that not all patients will come with bleeding. Not all patients with Lassa fever will present with bleeding. They will present with other symptoms. The bleeding may come later, or they may not have bleeding, and as such, this should be borne in mind. But Lassa fever is one of the viral hemorrhagic diseases, like Ebola, that can cause bleeding. So WHO goes on to say Lassa fever is endemic, is known to be endemic. That means it's recurring, something that is recurring in a particular region or place. So Lassa fever is known to be endemic in Benin Republic, in Ghana, in Guinea, in Liberia, in Mali, in Senegal, in Sierra Leone, in Nigeria. And you note that all these countries are in West Africa. WHO goes on to say it probably exists in other West African countries as well, but it's known to be endemic to these countries that I've mentioned. So, as an overview, it should be noted that it was first identified in 1969 in Nigeria. Lassa fever is named after the town where the first cases occurred. According to Gov UK, Lassa fever is a member of the Lassa virus. Lassa virus is a member of the arenavirus family. Arenavirus family. Lassa fever, the disease caused by the Lassa virus, was first described in the 1950s, and then the virus was identified in 1969 after two missionary nurses died from the disease in the Nigerian town of Lassa. So, other explanations: Lassa fever is a zoonotic disease, meaning that humans become infected from contact with infected animals. The animal reservoir or host of Lassa virus is a rodent of the genus Mastomys, commonly known as multi-mammate rats, Mastomys natalensis. Mastomys rats infected with Lassa virus do not become ill, but they can share the virus in their urine and feces. About 80% of people who become infected with Lassa virus have no or mild symptoms. So this should be borne in mind. 80% of people who are infected with Lassa virus do not show symptoms, or when they show symptoms, symptoms are mild. 80%. That is 4 in 5. If 5 people are infected with Lassa virus, either they don't, if 5 people are infected, 4 of them will not show symptoms, or if they show symptoms, symptoms will be so mild that you will not link it to Lassa virus. That should be borne in mind. It is 1 in 5. Out of those 5 people, is 1 in 5 infections that will result in severe disease. where the virus affects several organs such as the liver, spleen, and kidneys. How is this transmitted? Humans primarily become infected either through exposure to food or household items that are contaminated with urine or feces of infected mastomys rats, or directly via contact with infected rats. So as you say, this mastomys rat is the reservoir. It harbors the virus. The virus doesn't make it sick. The rat doesn't even know it's carrying something dangerous because it doesn't make the rat sick. But the rat can shed it in its urine and feces. So these rats, while eating household food, it can deposit urine and excreta into the food, into the household items. So humans now become affected when they are exposed to the food or household items that have been contaminated with the urine or feces of these rats. Another way is direct contact with infected rats. Handling rats. That is why I said that rats, dead or alive, if you trap a rat or you happen to kill a rat, do not handle it. Do not use your hand to hold it. You use something to pack it and dispose it properly. Do not handle it. Handling a rat, dead or alive, that has this virus can make you get contaminate can make you get infected. And also do not eat the rats. There are some places where rats, see, they are big rats, they look like lizards. Sorry, they look like rabbits. They are big rats, they look like rabbits, you know. So some places these rats could be prepared as food. So it's important that don't eat rats. Don't eat big rats that look like rabbits, because as you've seen in the account I read previously, somebody who ate a rat got infected and died as a result, and probably infected other people as well. So that should be borne in mind. Although to a much less extent, Lassa virus may also be spread between humans through direct contact with blood, urine, feces, or other bodily secretions of a person infected with Lassa fever. So the first major way a person can get Lassa fever is through eating food or household items exposed to these rats. If you keep food like bread, for example, you see that sometimes if you don't keep your bread well, the rat can eat the bread. In the process of eating the bread, they can deposit urine or saliva or excreta, and if you now go and take that bread, you get infected, you know. So the major way humans get infected with Lassa is through food, household items contaminated. That's the major way. Now, the less transmission from human to human is not as common as from rats to human. That point should be noted. But yes, the transmission can occur between one human to another human through direct contact with the blood or urine or feces or other bodily secretions of a person infected with Lassa fever. Person to person transmission may occur primarily in healthcare settings, where the virus may also spread by contaminated medical equipment such as reused needles. There is famous doctor who fought Lassa fever for many years in Sierra Leone, and then while taking care of one patient, he incidentally he had a needle prick while he was collecting blood sample from a Lassa fever patient. He mistakenly had a needle prick. The needle pricked him, and that's how the doctor that had over 25 years experience in treating Lassa fever, doctor who trained in Nigeria and went back to Sierra Leone, is from Sierra Leone, and is the expert on Lassa fever in managing Lassa fever patients. And at the point there were fewer hands in the facility, and he had to be collecting samples himself, and he got a needle prick. That's how he got infected and eventually died from Lassa fever. So needle prick. If you are collecting sample from a patient, whether the patient had Lassa fever or not, you have to be careful. If you are giving injection to a patient and it involves needles, you have to be careful. There are proper ways to this. There is a box. If in health facility in labs, there's a box where needles ought to be disposed. The needles should not be recapped. When you want to use a needle, a syringe and needle, you see that there's a cap. You have to remove the cap and use the syringe and needle. After using that syringe and needle, you don't put the cap back. You put that syringe and needle into the proper container, because that used needle, if it mistakenly pricks you, and the person happens to have something like Lassa fever, you can get contaminated in that process. So proper use of needles are very important. I've been to a lab where to run some tests, and my sample was collected, and the lab person, in a private lab, the lab person, after collecting sample, didn't have that patience to properly dispose the needle. Just threw the syringe and needle in the direction of the container, and the needle fell on the ground. Imagine the risk involved in that. So this one should be borne in mind. WHO goes on to say health workers are at risk if caring for Lassa fever patients in the absence of appropriate infection prevention and control practices. Now, it's important to note Lassa virus may persist in the semen of some males who recover from the disease for up to a few months. However, to date, no transmission via exposure to infected semen had ever been documented. There is no epidemiological evidence supporting airborne spread between humans. So, what this place is saying that even when someone has recovered from Lassa virus and you do the blood tests and is no longer detectable in the blood, the virus can still hide in the semen. The semen, the testicles are regarded as sanctuary sites. They are sites that even when you are taking antiviral treatment, those sites, the antivirus may not really get there, and so the virus will hide there. you know and then you check the blood, the person is negative, and the person is not showing symptoms, the person is discharged. It should be noted that it can be present in the semen of some men up to 3 months, or up to a few months. It has not been documented that transmission occurred via semen, but research shows that it can be present in the semen months after somebody has been discharged and the person has recovered. So that should be borne in mind. There is no evidence supporting airborne spread between humans. There is no evidence that it's airborne. That when you sit close to another person, or you shake hands, you know, with another person, that you just get it. There's no evidence to that, right? But there's something that it should be noted from CDC. People mostly get Lassa fever by eating or breathing in the virus. So you can breathe in the virus. You know how, right? So CDC says people mostly get Lassa fever by eating or breathing in the virus. For example, touching contaminated objects. Touch a contaminated object and then use that hand to touch your face or touch your mouth. Mm. Eating food that has the virus. Getting the virus in open cuts or sores. If you have an open wound or cut, make sure you cover it if you are working in a healthcare setting, because that place, the skin serves as a barrier towards things entering your body. So if there's a cut, that means that barrier is defective in that spot, and so someone can easily get the virus through that process. Eating rodents, eating rats, as I've mentioned before. Breathing in air that has infected urine or droppings. This may occur when cleaning or sweeping. um Now, imagine that you are a cleaner, or even is your own house. You have a part of the house that you have not used for some time and you want to use it, and rats have been are in around that place. There are a lot of rats, excreta and all that, and you are now sweeping. In the process of sweeping or cleaning the place, you can breathe in, according to the US CDC, you can breathe in air, you know, that has infected urine or droppings of these rats. So it's important, if you are cleaning a place or sweeping a place where there has been rats and all that, you wear a mask. First of all, a place that is very dusty, you could maybe water the place to reduce the dust. Then you could put on a mask, you know, then you ensure ventilation, you know, and then you should take note that if the air in that place is infected with urine or droppings of the rats, by sweeping or cleaning it, you could breathe it in. So this is a possibility and it should be noted. Even though it's not the major way people get it, but that possibility should be borne in mind. Then people with Lassa fever are not contagious until their symptoms begin. If somebody has Lassa virus, and the person is not symptomatic, the person is not showing any symptoms, the person is not likely to transmit it to you or transmit it to other people. The person only transmits it when symptoms develop. It is unlike some diseases like COVID, SARS-CoV-2, that we saw that even when you are not really symptomatic, you can still transmit it if you sneeze or talk or something like that. But in Lassa fever, you have to be symptomatic to transmit it. As I've said, if 5 people have it, 4 will not show symptoms or have mild symptoms. You know, it's 1 in 5 that will not show symptoms and get very sick. So that point should be noted. Lassa fever is not spread through casual contact, such as hugging, shaking hands, or sitting near somebody. You know, Casual contact, you are just sitting near the person, hugging, shaking, or sitting near somebody. Casual contact. There is no exchange of bodily fluids or secretions. These ones cannot make you get it. So that one should also be borne in mind too. The person is not symptomatic, is not likely to transmit it. And if there's casual contact, you are not likely to get that as well.